Welcome. Today's video we learn about StevensJohnson Syndrome, where treatment occurs, how that treatment happens, the time you should expect to be involved, and the medications. This is part of my ongoing series of videos on StevensJohnson Syndrome. Look to my YouTube channel for additional information. We're going to start right now. I'm Matt Hamilton. I'm a trial attorney. I specialize in helping victims, and often I'm called upon to represent victims of medication errors. I'm joined by Dr. K.K. Hamilton. Dr. Hamilton began her career as a clinical microbiologist. She worked in hematology, studying the blood, the bone marrow, and the microbiology of patients treating at some of the top hospitals in the United States. After she received her doctorate, she went on to a post-fellowship at KU Medical Center and has treated at a number of other hospitals. Today, she specializes in medical information and adverse events. Welcome, Doctor.
Thanks, Matt. Glad to be here.
Briefly, what is Stevens-Johnson syndrome?
Stevens-Johnson syndrome is an allergic reaction that your body develops, most commonly affected by use of drugs or medications that usually you're prescribed to treat some sort of health condition. So Stevens-Johnson syndrome is a spectrum of diseases, spectrum of disorder, where we'll also discuss in the next few minutes here in relation to timing of treatment and hospitalization that you will be experiencing depending on what severity of Stevens-Johnson's you have. With Stevens-Johnson's, there's also involved with the skin system, which you will hear the term toxic epidermal necrolysis, and I'll go into that further when we talk about timing and treatment.
Toxic epidermal necrolysis is the harsher, worse cousin of Stevens-Johnson syndrome, yes?
Anymore, it's basically Stevens-Johnson's, but a severe case.
I see.
Mm-hmm.
Stevens-Johnson syndrome typically occurs because a mistake is made, yes?
Typically, it's a mistake, knowing that the drug that you're taking is, you are reacting to it. So the mistake is where, there's a delay in recognition that that's the offending agent, and then your body reacts and it gives into further damage.
So if you put down, hey, I'm allergic to amoxicillin, they give you amoxicillin, you could develop Stevens-Johnson syndrome or toxic epidermal necrolysis. It could kill you.
Yes. If that's not recognized sooner and, the offending agent is not removed in appropriate time and that's not recognized, yes, it can harm you. And, with follow-up, secondary things like infection and things like that can kill you.
How is this treated?
Well, it's supportive care, when that develops, depending on the degree of the spectrum of Stevens-Johnson's syndromes that you do experience. For example, the worst case scenario is 10, or the toxic epidermal necrolysis that you experience, which is basically your whole skin system sloughing off. So you can also compare that to being a burn patient, getting scalded and having your skin peel off. So in that terms, length of stay is depending on how you heal. So it could be, anywhere, if you have Stevens-Johnson's, it could be anywhere from a week, to more than, up to 3 months, depending on the severity. If it involves your whole body and it affects your whole organ system, and if your organ system starts to shut down, then you might end up in, more like an intensive care unit setting.
So if you are a victim of Stevens-Johnson syndrome, or someone close to you is, and you're worrying about the time of treatment, how long they should be treating, we're talking from 2 to 3 weeks to an extended stay, depending upon the severity.
Oh, definitely. And, even after hospitalization, you have to think about, physical therapy and follow-up care and follow-up treatment. And then in some instances, patients experience lifelong complications.
It can be permanent. It
can be permanent damage, as it affects your skin system. It can affect your other parts of your body long term. If you suffer and if it has enough of an effect of a damage, then yes, lifelong, long term.
So the first thing for the physician to do is recognize that they're dealing with Stevens-Johnson syndrome, to identify it, yes?
Correct. And then then first and foremost is what is the cause. As soon as you identify the cause, removing of that cause is of utmost importance.
Stop the offending agent.
Yes.
How important is a sterile environment for treatment of this?
So for example, if if you do have the TEN or the toxic epidermal necrolysis, that is of utmost importance because, now your natural barrier skin, which protects you from the outside world of, infectious diseases is no longer there. So that puts you at risk to the most common bugs or microbes, that normally would not harm you. But in this instance, you don't have that protective barrier. So you definitely need to be put in isolation. And all the precautions, such as the burn unit is one of a good example that patients with toxic epidermal necrolysis can be isolated, and if they do suffer the worst case scenario, which is the majority of their body.
So we're talking intensive care unit or a burn unit for severe cases.
Yes, and that's where you start. So now, as you get better with supportive treatment, medications, and then afterwards, it might be length of stay might be increased, and you might be stepping down to a more general floor within the hospital, but you still need hospital care.
Doctor, to what extent and at what time should we expect to be treating the symptomology, just treating the symptoms at this point?
I go back to the same recommendation, anywhere from, up to the first day of you staying. It can be up to 3 months, up to even lifelong with these symptoms, long-lasting symptoms, specifically with pain or, any other additional things that may come up. So some people it may affect their lungs and things like that. And, they might be more prone to infection lifelong. So symptom-wise, Matt, it might be lifelong. But for more of the severe immediate cases, it can be anywhere up to 3 months that you're treated with these more intensive hospital care treatments.
How much of a concern is dehydration?
Well, dehydration with Stevens-Johnson's, again, we're going back to the more severe case where you have skin damage. That is of utmost importance as well, next to being thinking about the infection treatment, because when your body is not well maintained in hydration, things can go wrong with, like, for example, organ damage, blood pressure changes, and things like that. So it's really critical to maintain hydration, either with infusion of fluids, like saline or any other medications that help you maintain fluid. And some of the things you have to think about is maintaining nutrition as well, because you might not want to eat, especially when your skin is sloughing, and it does involve your mouth, so very, very painful. So just so many symptoms that you have to think about.
Okay. Nutrition's an issue. Should these patients expect at some point to undergo physical therapy?
Oh, most definitely, if it's depending on the degree and how much of your body is involved. Commonly we think about burn patients. So when you're healing, your skin is forming scar tissue and things like that. And so you're going to have to be adjusting to your a new normal. So in terms of your usual daily activities before, this incident happened, you'll have to learn how to do the most simplest things. If you have, like, your hands and your joints and things like that may be affected.
I know you're an expert in medications. What medications should we expect to be talking about when we're treating Stevens-Johnson syndrome?
Well, the one that comes to mind, depending on the spectrum of Stevens-Johnson's, can be the most common treatment is steroids, which in that terms, it helps your body, with the inflammation process. And if you have more of the higher end of the spectrum, the disease, like toxic epidermal necrolysis, you're going to be thinking about systemic antibiotics, and again, fluid just for hydration and things like that, and everything else in between, just because you are exposed, to infection, and you are at risk for organ damage. And so basically any medication you can think of, Matt, that is available to us and technology-wise in order to make sure you stay healthy.
Okay, so it's responsive, somewhat defensive in nature.
Yes, you're very much, and with the antibiotics, more of an an offense in terms of proactively treating you, and also providing antibiotics. You might not have these infections yet, but since you're such at risk they're called prophylactic treatment. They're just being given to you just to cover, just to make sure that, you know, some of the known bugs or the known microbes to cause infection in this patient population. Usually these medications are given even though you don't have infection yet, just to make sure that you're safe.
How much pain medication should they expect?
Pain medication, just with burns, you know, as an audience, they might not be very familiar with burn severity. It could be, you know, things like morphine, you know, things like that, long acting, short acting medication, IV pain medication. This, you know, the pain severity could be pretty hard to tolerate, you know, when your skin is sloughing off and things like that, and then as you're healing as well. So expect long-term pain treatment can be part of the whole equation as well. So like I said, where we mentioned before, any drug and every drug in the hospital that's available, patients who experience Stevens-Johnson's may come in contact with at any point in time.
They're going to be debriding the dead skin off their body, and that's going to be painful.
Yes, and so one of the most important treatments, you know, again with burn patients, if you have dead, which is called the necrolysis portion, is, you know, you don't want dead skin just sticking around, because then again infection risk and things like that. So you definitely want to clean that off, and during that process, it's definitely not a pleasant. You know,
it hurts.
It hurts. You know, so I mean, they're gonna have things in place, you know, either to help you cope with the pain with pain medications, or either if it's too much, you know, you might be put under, as you say, you know, anesthesia and things like that to help you along.
Well, Doctor, thank you today for discussing this with us. I'd like you to comment below what your experience is so that we can improve and add to these videos. If you'd like further information, go to my website. I have detailed lists on Stevens-Johnson Syndrome that I think you'll find very informative. And if you have further questions, you can call me at my office and we'll try to learn the answer together. I'm Matt Hamilton. I'm here with Dr. K.K. Hamilton. Thank you for joining us.